Columbia Global Centers Nairobi welcomes you to our webinar this afternoon on navigating work and home responsibility during the pandemic. Thank you for joining us. This webinar will be recorded and can be accessed on our YouTube channel in the coming week. To ensure your safety, some features have been disabled, these being audio and video sharing, screen share, and chat. You are welcome to submit your questions using the Q&A feature at the bottom of your screen. The moderator will guide the panel to answer your questions at the end of the session. We are delighted that you joined us today. For more engaging and educative programs, please subscribe to our mailing list by visiting our Contact Us page on our website, globalcenters.columbia.edu/Nairobi. I would now like to hand over to our director, Dr. Murugi Dirango. Welcome, Dr. Dirango.
Thank you, Pauline. Good morning, good afternoon, and good evening to our global audience, and welcome. I am Murugi Dirango, Director of Columbia Global Centers Nairobi, one of 9 centers across the globe established by Columbia University, New York, to connect the local with the global, to create opportunities for shared learning, and to deepen the nature of global dialogue. Today, we are delighted to host a distinguished panel to discuss how to navigate work and home responsibilities during the COVID-19 pandemic. Along with the terrible toll of lives lost and the negative economic consequences, the COVID-19 pandemic has forced dramatic changes in the way families navigate work inside and outside the home. Parents are juggling work from home, homeschooling, and household chores. Our panel from Kenya and the United States features experts in family counseling and gender roles, and will discuss how families can thrive while managing their responsibilities during the COVID-19 pandemic. I would now like to introduce our moderator, Dr. Julia Kagonda, a counseling psychologist and communication specialist consultant at Elimu Trust and lecturer at Daystar University, Nairobi, Kenya, to introduce our speakers. Welcome, Dr. Kagonda.
Thank you very much, Dr. Murugi. Good afternoon and good morning, everyone. It's a pleasure to have all of you here, and we look forward to a lot of interaction in regard to this topic that is very important and that is very real globally as we discuss it. And with us today to help us in this discussion are our panelists, Dr. Susan Getao and Dr. Aaron Wallen. And just to tell you a little bit about Dr. Susan Getao, she's the department chair and a lecturer at Nazarene University. Nazarene University is in Kenya. Susan, or Dr. Susan, is also a counseling psychologist and supervisor with one of the biggest psychological and counseling associations here in Kenya. She's also the founder of Susan Getao Counseling Foundation. Welcome, Susan. With us again, like I said, is Dr. Aaron Wallen, who is a senior lecturer in Human Capital Management, Columbia University School of Professional Studies. He's the academic director of non-degree programs. He's also a researcher and a consultant in human resources related issues. As you can see from their bio, they have a lot of experience and knowledge that we can draw from as we think about this relevant topic that we have today about navigating home and work responsibilities. And we are just going to go straight away, and I will invite Dr. Susan Getao to just set the context and tell us what some of the challenges that we are facing as we think about COVID-19. Welcome. Susan, you need to unmute yourself.
The way I was muted, I stayed on. So thank you very much, Dr. Kagonda, for giving me the floor first. I didn't expect, but it's okay. And it's also good to clarify that I head the counseling department at Africa Nazarene University. People call it Nazarene University, but it's Africa Nazarene University because there are many Nazarene universities globally. One of the things I would like to highlight is general, that in March 13, the president of Kenya required all employers to release their employees to start working from home. And immediately there were all these challenges because working from home would mean for some people, you must have a laptop or you must have a desktop at home, you must have Wi-Fi connection, you must have lighting. Some places in Kenya don't have lighting every day. There is a lot of rationing of lighting. It meant that you also have comfortable furniture at home. It also meant for the employer to have effective monitoring and evaluation strategies, because you can say you are working remotely, but for sure, probably you're not working remotely. The employee now who is working from home needed to re-engineer or reorganize his or her structure working from home. Because again, at the same time, all children, the ones who are in school from early childhood development all the way to university, were required to go home immediately. So you're having children having come from home when you least expected them to come, you didn't have a plan for them, and then the employer says you're now working remotely, and so many other challenges that also came up. Some people had to go home on compulsory leave because now the employer says there's no work for you because your work requires you to come work face to face. And so we are having people in this country right now who are jobless. We are having others who are on compulsory leave without pay, but not assured that they will ever go back. We are having other people with pay cuts at this particular moment. We are having others with delayed salaries. So we are having financial or what we can call socioeconomic challenges. And when we come to the psychological part of it, we are realizing in Kenya we have increased cases of teenage pregnancy. We are going to delve into that. We are having increased cases of sexual and gender-based violence. We are having increased cases of criminal activities. We are also having a lot of anxiety generally because when we had the first few cases, there were so many lockdowns. But right now, when the cases have risen extremely high, we are opening the county borders. And so the country and everybody, and I want to say it's every sector, we are in a state of anxiety. We don't know. We are having people we've known, people we have followed, great preachers, great leaders in this country confessing that they have contracted COVID-19. We are having small children. We are having teenagers. Again, we are having people taking their own lives. We are having people killing their loved ones. There was this situation that shocked everybody, a mother that took the lives of her only 4 children. And from the way she was talking, if you analyze everything she was saying, it has a lot to do with COVID-19. So if we were to actually do a study, we would be able to find that majority of people have also been traumatized. We don't have the data that, right now, but the president yesterday said that we should speed up collecting data on rising cases of sexual and gender-based violence. And he also said the mental health task force should speed up, again, the implementation of the report that they gathered in the last 4 months. So we are having also leaders being very confused. So Warren, it's not just in America. Here we are having leaders, they don't know whether they should start campaigning for their votes for 2022, or they should take care of COVID-19 in their specific counties. And so we are having a country that is shaken. What about the church in this country? Well, the president said you can open up the churches, but only with 100 members. You can imagine, how are you going to tell them you will be the first 100? So it's just like not opening. So at the end of the day, you will find very many people who sought for solace in the church. Africans are notoriously religious. They don't have that space that was their resource. So we are having very many pastors, very many preachers, very many faith-based leaders really pushing the president because they are associating the rising cases of SGBV, the rising cases of depression, trauma, anxiety to these resources that help people in Africa to feel part of their society, because their isolation is like it broke the African fabric of feeling we are together. So it's like we are also forgetting that COVID-19 is real. And so when the president announced that now I have opened the inter-county borders, you should have seen the celebration in this country. So you are asking yourself, is that a mind that is normal? And so I think it's a debate Dr. Kagunda will delve into, but I don't want to be ahead of our discussion. Otherwise, I would generally say that is the state of this country. Yeah.
Thank you, Susan. It sounds like a lot of loss, a lot of confusion, a lot of anxiety in this part of the world. And it would be interesting to hear from Dr. Wallen what is happening in the US or the Western countries.
Thank you, Dr. Kagunda. And yeah, I think, Dr. Gitao, what you just covered is very similar to what we're seeing here, although I think some of the cultural differences between the US and Kenya end up leading to the manifestation of effects being slightly different. So here we have, the US is divided into 50 states, and each of the states has a governor. So you have a very sort of lack of national level leadership at the current time, giving any sort of guidance. Even within the federal government at the national level, different people are saying different things. Our Dr. Fauci, who's sort of taking the lead in terms of the medical response, says one thing, the president says something different, later the same day. No, I disagree with Dr. Fauci. And then you have 50 state governors who are each running things in their own way and often aligned with their political alignments and preferences and sort of party platforms. And so depending where you live in this country, you could be having a very different experience. Early in the pandemic, the cluster of cases were highest in the New York City metropolitan area. And so the rest of the country sort of was in large ways unfazed. It's sort of not our problem. It was sort of described as an urban problem. It's that dense New York City with all its subways, with its dirty subways and buses that is leading to this. And it's not where we live out in the rural areas of the country. Sure, you had a little bit in other states, but it wasn't as much a national problem. Then you saw the cases kind of go down in our area, and of late, the big news stories in the US is just the explosion of cases in many of the states that were unaffected early on. You're not seeing a very good alignment between the leadership in many cases of those states, the governors, with the realities on the ground, the explosion in cases in terms of what they're doing to mitigate any potential health or life effects. So they're ending up not closing down and in fact suggesting that there will be further openings. So I think either yesterday or today, the governor of Florida, which is sort of right now the epicenter in this country, said, schools will open. For them, it's in August. I refer to it as the fall. So in the fall, schools are going to open up. A lot of people are nervous. The teachers unions down there are saying, we're not so sure we're comfortable with this. It's one thing to say that you want this to happen, but do we want to see it happen? Psychologically, again, I think it depends on where you live in this country. I think those of us in the New York City area who witnessed the makeshift morgues that were, brought in next to the hospitals and knew directly either people who were affected by COVID, they had loved ones pass away, they were seriously ill, their family works in the healthcare fields or other frontline workers. We know how devastating it was. And I think people have been shocked into being a little more careful about how they conduct themselves. So they're wearing masks a little more often, I think, in this part of the country. They're maintaining social distance. Our governors are opening up things much more slowly. In other parts of the country, it's as if masks and any mitigation steps are a political statement, and therefore there's a lot of resistance to that. So I think psychologically you're seeing a lot of denial, a lot of, early on you hear it's just the flu, it's a strong flu, it's not such a big deal. And then you hear things like it only affects sick people, the elderly, so it's not really my problem. And you have an explosion among the sort of 20-year-old to 40-year-old population who are going out to bars, who are socializing. And we've seen pictures where they're packed in pools, drinking beer together, and just like it was, last summer, like nothing had ever happened. And yes, we have issues of increased domestic violence because people are in the home more often. And it's harder when we're under stay-at-home orders for the survivors to get out and be able to seek for help. And there's a lot of uncertainty still. I think there's fear of a second wave. There's fear of, are we still in the first wave? What's going to happen? So a lot of the same things. I think anxiety, stress, having to mix work and life and childcare, it's just incredibly difficult for most people right now.
Thank you, Dr. Wallen. And let's just pick from the last thing you said about having to balance work and home. And like we are talking about today is navigating work and home, where we are seeing both globally with the lockdown and all that people are starting to or have been working at home. And of course, one of the questions we are asking ourselves today is, how is that playing out during this global season, where the boundary between home and office is no longer there? It's all mixed up. Maybe you can start with us, Dr. Wallen. How is that playing out from a global point of view?
Yeah, so just before I speak to that, so I just want to say there are plenty of people who still don't have the choice to work from home and are in critical positions where they're still out there having to bear the brunt of exposure and having to deal with stressed out people. So I just want to make note of that. It's an important piece of the economy and an important piece of what people are suffering through right now. For those of us who have the option, largely white collar, typical corporate office workers, service workers in some cases, who are not in travel, who don't have to be immediately customer facing or client facing, yes, we have the ability to work from home. So what's going on with that? Most of the schools were closed. Most of the child cares were closed. So you had to be a elementary school or high school instructor, as well as whatever your primary job was. You have to entertain the children when you're not doing that. You have to do the work that your company and your bosses are expecting of you. You might be on a call at any, since they know you're at home, you're kind of always available in a lot of ways. So there's always this possibility of being reached and having to kind of be on all the time in a sense. And then all the household work that still needs to get done, cleaning, cooking, shopping for groceries, taking out the trash, repairing things. All of that is still going on as well. And I think for most people, there had been a movement towards more flexibility, especially in the tech sector where there was more remote work. You have organizations that are entirely remote, entirely distributed. And, they've planned for that. They have yearly get-togethers to build company culture. They feel comfortable working in that way. I think for a lot of other people, it's been a shock. Besides the issues of technology that Dr. Gitao mentioned, there are issues of, what happens to water cooler chats, what we call water cooler chats. You're in the coffee break room and you have this brilliant idea that you want to run by a colleague. How does that get done anymore? Do I just quickly Zoom somebody out of the blue? I used to knock on a colleague's office door and say, hey, I want to chat about this idea I have. And that was socially acceptable. I think to randomly Zoom chat somebody, I don't know that we're there yet. Maybe some organizations are setting up that culture. So I think things like that, we need to pay some attention. How are we going to regain those kind of informal relationships at work? I mean, we're social creatures. We need contact with other humans. And I'm not sure, Zoom in some ways gets you that, and in a lot of ways it gets you fatigue and stress. So I'm not sure that that's the solution to that. And I'm not sure that we're wired, this may be the wrong word, I don't know that humans are wired for remote socialization. I don't know that it meets the same needs as being in the same room with somebody, and you know, now being able to like shake hands and touch somebody. I'm not even talking about that, but just being in the same space. That informality, I just don't think it's quite there yet. And I think organizations and managers need to be systematic about building that back in to help both the workflow and to make the social vibe at work somewhat restored.
Okay. Thank you, Dr. Wallen. Susan, we just been told, as Dr. Murugi said, that the president in Kenya yesterday made this announcement. It's been opened up. But as much as it's been opened up, one of the things that came out clearly is that schools will not be opened until January. So the issue of navigating home and work still remains a challenge for many couples or for many families. Maybe you can share how that is playing out and some of the challenges that come with it, especially from an African perspective.
Thank you once more. And I hear there are some areas we are the same with the US from Dr. Wallen. We are actually crying and dying for social physical connection. Actually, we are saying this social distancing is real. It's not the physical one, that's 1 meter, 1.5. One of the things I would like to say, it is already very hot for parents in Kenya. And one of the things I have realized is that parents, I think they need to learn or relearn how to parent their children. It is like children in this country listen to teachers more than they do their parents. They can attend to the Zoom classes very well. They can do the assignments up to now very well. But listening to their parents, it's actually a big challenge. Only probably a few parents who have known that we need to roll with the changes and what is happening. Because our children in Kenya, some of them, it's the first time they are touching the phones that they've always wanted their parents to buy. But now they have the phones, they have the laptops, they have the computers at home because they are studying online. And they are exploring more what is inside, what is online, more than actually learning. So long as they do assignments and finish with them, then they go to exploring other sites. So we are having very many of our children getting hooked to pornographic sites, getting hooked to games more than ever before. And the parents do not know how to handle this. We also have very small homes, Dr. Wallen, here in Kenya. And so when people are told you are signing a contract, an agreement that requires you to work from home, some parents are actually doing their work outside the house, because inside the house, everybody is packed there with their own thing. If the children are having their online studies, you are supposed to be in a meeting as a father, and you as a mother as well, especially for the dual career couples. It means the children are still left on their own. So it's so ironical that we are saying these children are with the parents at home, but ideally they are not. Even speaking from where I work at Africa Nazarene University, our admin assistant is actually the youngest in the department. And every time we are having a meeting, whether you like it or not, her children are young. We always hear them in the background. Some even say, let me say hello to auntie, that auntie over there, or that uncle. And so in most cases, Wallen, we are not doing a lot of this sharing screens and especially doing video calls and communication, because you'll be shocked with what is in the background. We also having a lot of noise, is because as we live in, we are a shouting community, we talk a lot. And so you might be in a very serious webinar or even office meeting, and then your neighbor puts music full blast, and like probably in your country. And because here the regulatory bodies right now, everybody is in a state of confusion. So you're finding parents at the end of the day, having had to be the disciplinarian for their children, the work they had given the teacher. They have to be the preacher. Here we pray. So we have turned our homes into places of worship. So you have to lead. You are the bishop as the mother, the assistant bishop, and then we have the children. You can make them to be preachers, because if you have to cultivate that spiritual well-being of the children, then you must take the lead. Some parents, these are the things they did long time ago in Sunday school. Some of them were a bit better, for example, who are already church ministers here, or they are the caddies or the teachers in the temples or in the mosques. But most parents are having a very difficult time. In fact, if there are people who are really pushing for schools to be opened, are parents. And they are saying, are the teachers still being paid? So there's even a very big conflict. But these teachers are also parents. So we are also having parents who have never known how to manage their children, because every time we close schools in Kenya, it's like only 2 weeks. Because the first week you are settling down, the last week you're busy shopping for them to go back to school, especially those that are in boarding schools. So we are having parents who do not know how to structure the day for their children. In fact, when the CS, the cabinet secretary, announced that it's gonna be a whole year lost, some parents never had sleep. But for me, as we will come to discuss probably what is the way forward, I would say it is a big awakening for parents that if we were given our children and going forward, COVID puts us or any other pandemic to a situation that the only option in homeschooling, what happens? We also having parents, especially from poor communities or remote places or in the informal settlements, their children don't know what you people are talking about having online classes. They have never seen a smartphone. They don't know what that is. If they ever saw a laptop somewhere, maybe I don't know where. And there's a big project the president had initiated in this country. And right now it's when people are thinking, why did we kill that project where every child was to own a tablet that was to be fed with all the learning resources for their class level. But it is only a handful, like a school that I support in the right of one of the biggest slums in my county, that is called Kiambu County. They have only 100 tablets, and the students or learners are 998. So those tablets are still in the storage. So who do you give? How do you even distribute that? Those people living in the remote areas of Kenya, there is no power. There is no network. We have 3 network providers in Kenya: Safaricom, we have Airtel, and we have Telco. And some people have to climb trees or go on top of mountains to get some network connectivity. So those are the students from primary all the way to university. And your child who is a student at the university, who is 18 years and above, is also at home. So we are having parents highly stressed. And again, these parents could be the parents who are not working, that maybe they used to run those businesses that have been closed down. Like if you are running a hotel, and we eat, Dr. Wallen, we eat here in Kenya, but all those hotels are closed down. So you will find that those parents are at home with their children. And these children have turned to be something else parents have never known. They have turned to thieves. I don't know whether you saw a video that went viral of a high school student. This was a male student who had stolen chicken, probably because they were hungry. But the villagers stripped this boy stark naked and tied his hands and actually hung the chicken behind his back. And they started parading him. So we are also saying that parents are suffering in a way that they had never experienced before. So I don't know whether we could call it parenting trauma, parenting traumatic stress, or whatever it is, because they are like, I don't know whether these are my children. I can't handle my children. And so we are left even wondering, should the teachers be deployed to teach from door to door as they instill discipline? And one of the things I would say at this moment, again, these parents in Africa, we value silence. We actually say, don't talk so much about your family matters. So even if there are domestic violence cases, people are hush until you see somebody has been cut their hand, somebody has been slashed, they have gone to report, and we get reports from the police. Nobody even wants to talk about it. We are having children being abused physically, emotionally, psychologically by parents who are already mentally sick or ill. But because mental illness is not visible as such, these rising cases of domestic violence are ongoing. We are also having parents at this particular moment who are neglectful. We are having parents who are never abusing alcohol and drugs, but they are doing right now. They are saying, oh, we've always had people sleep well when they drink this. And they are not drinking beer or spirits that are high quality, it's low quality. So we are also having very many cases that are supposed to go to rehabilitation, but rehabilitations are being treated like health centers, so they can't go there. So what are we saying? A very stressed up family. And unless a radical intervention is done that is multi-sectoral, we are having a very stressed family, very stressed parents, very stressed children.
A lot of stress there. Very good. A lot of issues you brought in there. And shortly we'll be asking ourselves, what's the way forward? What are some of the things we can do differently? Because like we have said, our children are going to be at home until maybe January. Like we said, although the workplace has been opened up, we don't know whether people will go to work or this working at home will still continue. So we'll be looking at the solutions. But before we do that, Dr. Wallen, maybe you can just share with us briefly the role of gender stereotypes in this kind of environment we are talking about.
Yes,
working at home.
Thank you. Happy to. So just quickly, I won't go into too much detail, but generally realize that there are gender stereotypes. It's not just men who think about that women are a certain way or women think men are a certain way. It's that both men and women think women are a certain way and vice versa. There are both descriptive and prescriptive stereotypes. Descriptive stereotypes are what women and men are seen as being like, what they are. Prescriptive stereotypes are what they are seen as ought to do's. So just there's that very important distinction. So for example, a common stereotype of men in a lot of cultures and a lot of countries is that men are tough and strong. So that's descriptive because it's describing how people see them. Versus prescriptive, which is men ought to be tough and strong. And there's a different implication as far as not being consistent with that stereotype, depending if it's the descriptive version or the prescriptive version. And generally, stereotypes are these cognitive schemas that we have, our way of making quick decisions about the world. And if you're into any of the audience is into cognitive psychology or neuroscience, I think they'll be familiar with this idea that there are sort of two cognitive or two thinking systems that we've sort of evolved with. One of those systems is this quick heuristic version, the version that makes very quick snap decisions. That person's somebody I like. That person looks smart. That person looks wealthy. That person looks like somebody I want to stay away from. And in milliseconds, we've come to that conclusion. Versus the more systematic, thoughtful way of thinking, where we take the time to evaluate more and more about the person or the decision that we're going to face and come up with an informed, considered solution. So stereotypes are in that first bucket. They're in that quick bucket. And a question that the audience might be wondering is like, where do these things come from, right? They're not necessarily something we're born with, and they're not injected into us with our inoculations when we're newborn. So where do they come from? They come from the social world. They come from us watching how people of different groups are treated. And with respect to gender, one of the prominent theories about where stereotypes come from is Alice Igley's social role theory, which is the idea that we develop our ideas of gender stereotypes by watching what people of different genders do. And so if you have a lot of men predominantly in roles that are like construction and physical labor, and they're in roles of leadership within corporate settings, that starts to say, well, if men are doing these things, and to be successful at those things, like construction, you need to be strong and tough and gritty, and to be a successful leader, you have to be decisive. And I see mostly men doing that sort of stuff, then I'm going to associate those characteristics with men. And if I mostly look around and I see women are the ones with the children around and mostly are in occupations like nursing and teaching, certainly in the US at least, in the current time period, I'm going to start to think, well, what do nurses and teachers do? They educate, they nurture, they take care of, they are other oriented. And then I start to associate those characteristics with women. So those are stereotypes, right? So now in terms of our current problem, this issue with dual career. So if we've all grown up in a culture where, and I think most of the world is like this, unfortunately, where there is there is a dichotomy between the stereotypes with respect to the genders. Now that we're in this situation that it's unfamiliar to us, what we're going to do, what humans do, they fall back on the heuristics. They fall back on these quick decisions in times of stress. So they're going to stereotype more readily. And so it might just be the default assumption. What I'm personally worried about is the default. The assumption is, all right, now we're both stuck in the house. Woman, it's your job to do all the household labor and to take care of the kids. And I've always been out, like, men do the work. And regardless of whether we both had been working outside the home, woman, you're going to do all of that extra stuff, all that household stuff. And the man might not automatically think of taking that on. And of course, I am generalizing here. I'm not suggesting in a lot of instances, this is not how things work. But I'm fearful that it might be how things end up when people aren't being thoughtful about it. And some of the cross-cultural research I looked into prior to doing this suggested that it is, even though there's more acceptance of women and men working outside the home, there is not necessarily more uptake on men doing the household work. So women are getting stuff added to. It's not that there's a rebalancing of the distribution of that men are taking on more household chores. It's that women are getting all this extra stuff they have to do. And then I worry with prescriptive stereotypes, if they're not doing what they're seen as ought to be doing, then they get penalized. And I have a line of research showing that when women aren't seen as prescriptively consistent, they're not being nurturing, or they're being strong and active and agentic, that they're going to be thought of as less likable. And I would worry what this means in a domestic situation. And so I would hope that we could, there could be some education around the existence of these stereotypes. Now, I think the only thing, this is off topic, but the only thing that's going to undo gender stereotypes is a redistribution into work roles. And that takes decades and years. That's not going to happen today. That's not an immediate solution. But in the immediate, to at least be aware of those stereotypes and not just to say, well, you're doing that because, I think women ought to do that. And men, you're doing this because men ought to do that. Let's get beyond that and get into that more systematic way of thinking, the more thoughtful approach, so that nobody is getting an unfair burden. And it's never going to be perfect, but at least let's make it a little more toward perfect and a little less toward it's all on this one person. Mm-hmm. Sorry if I was long-winded.
Thank you, Dr. Wallen. And possibly from what you're saying about gender stereotypes and all that, it may explain some of the violence we are seeing, because there is what is expected of men. Maybe they're expected to be out and they feel the pressure of being out. There is what is expected of women and all that kind of thing. And possibly it may trigger even the violence we are talking about here.
I think that's great. I think it's one, I'm sorry to interrupt. I think it's one of several potential causes. I don't think it should be ignored, but it could be a way by which men restore that stereotype. So it's just one piece of it. Sorry.
Let's look a little bit at the solutions. We have brought in a number of challenges as we think about this navigating work and home responsibilities. And maybe Dr. Susan, you can start with telling us maybe 3 key things you think as would make a difference. You talked about parenting and the challenge in there. You're talking about children being exposed to all kinds of things because of being on online, mental health that is stigmatized. Maybe you can tell us from a mental health point of view, what are some of the things we need to do differently to address the challenges we are facing currently?
I would like to discuss this from a point of my context. This is where we are. I'm talking about Kenya in particular, and so I can talk about probably East Africa and maybe the rest of Africa, because as Wallen is talking about the gender stereotypes, for us it's almost like it's written, those unwritten rules that the kitchen belongs to the woman. But right now, you don't know who belongs where, because if all of us are working from home and the children are all over and we are there, it's like there's a very big paradigm shift that COVID-19 has put. We are calling it in Kenya the new normal, even in the family setting. And probably I would say, if it's at the working from home, the employer-employee, the employer must think, if I want my employee to work from home, how do I ensure that I'm not making them suffer mentally because now they have to work from home? Do they have the resources? Do they have the internet connectivity? Do they have the computer or the laptops? Do they have that? If it's about communication, like if they are in administrative positions, do they have enough airtime that they can easily monitor the people who are under them? So we do have the employee assistant programs being transformed to actually meet the challenges of COVID-19. If I talk about the family setting, the parents who are the leaders of any family setting, they now need to know that our parenting must conform to the challenges brought about by COVID-19 in the household setup. If it is about learning from home, the parent now needs to know that I am the key supervisor of my child. So how do you, as a parent, create an environment of learning at home that is going to help your child not to lose track of school life? I would also talk about generally the leadership, especially coming from the Ministry of Health, going to the Directorate or the Department of Mental Health, coming down to the community levels. Right now, there's nothing that is going to work more effectively as having community-based mental health interventions. And so if we do not have that, we can continue talking through the media, through the social media, but people will continue killing each other, killing themselves, abusing children, abandoning their duties. So I would basically, for me, Dr. Kagunda would go to that. And if I have to go to individuals like you and I, and especially the ones now in learning institutions, you are in this African Nazarene University, we have Dr. Wallen in a learning institution. Right now, what are we telling ourselves? Because those institutions in Kenya that did not digitalize teaching and learning, right now they are highly disadvantaged. And they are running helter-skelter. Is it gonna be Zoom? Is it gonna be WebEx? Is it gonna be what? So at this particular moment, there are big questions for educators. What are we doing with that large mass of students who are not in school? What is happening in their lives? Are they the ones we are saying that they have to get a breakout and go out there, get contract COVID-19 and bring it to us? Because anytime a young person is left idle doing nothing, they will definitely look for something. They have to get a way to ventilate. And what is happening here in Kenya, you'll be shocked with the things they are doing. We are being challenged as learning institutions to come up with, because this is not gonna change. We are calling it the new normal, but it's gonna be like the new way of life, because we are not going to change from online teaching and learning. Right now, it is like, this is the way. So how prepared are we from early childhood, primary or elementary schools, secondary or senior schools, all the way tertiary institutions and universities? What about the big question of competence-based learning and teaching? Because if you look at our children right now, Dr. Kagonda, and I want you to just visit homes if you can, or start asking parents what's going on. They're actually doing what we used to do in the 1970s or early 1980s. They're actually going to the shamba for Dr. Wallen and others in the diaspora is that home garden. And they're going there to turn the soil and make pots. The creativity that had been killed, instead of parents seeing re-engineering of things and taking advantage of that, they are thinking it's retrogressive. But from where I sit, it is the educators, the leaders in education to think, is time up for us to offer education that is only gearing to taking me to be a doctor, to be a holder of a master's degree, not a skilled person. Those of us who are depressed because they can't think differently, is it a confirmation right now that your creativity died long time ago? Those of us who have been resistant to digitalization of learning, communication, marketing, and all that, we are now being forced. Where are you able to do it? Is it time to know that we resist some things that really mean a lot to us? What about the gender stereotypes? Is it time to change? The way I look at a woman, the way I look at a man, the way I look at my daughter, the way I look at my son, the way I look at my sister, the way I look at my brother. Because wherever we are right now is different. We are having leaders who are emerging right now, Dr. Wallen, in this country, that they are speaking things that have been oppressed for so long. But this is a time they are being heard. This is a time they are called from each corner. Oh, now we need you because it's a crisis. Does that speak to us that we have deficit in crisis leadership? That tomorrow we are hit by another pandemic, and God forbid, or any other crisis situation, we are still going to register increased cases of sexual and gender-based violence. We are going to close our schools like forever, and no learning goes on, only in those institutions where they had online learning platform. I feel sad, Dr. Wallen, that my university, we are still teaching. But when I think about other universities where the largest number of poor children or learners are in public or what we call government institutions, are not going to school. And when I recall where I came from, very poor background, and because of education, I am put on the global platform, my heart sinks. And I'm asking myself, is it time to think through equality and equity? Because right now, however much my government can say we have enough social security, safety nets, we don't have. Because I could see our president in this nation, and I don't hide what I see because I am a behaviorist, a psychologist who observes behavior. He did it under pressure. There are people who had to be released to go and look for food for their families. There are people who had to be released to go and meet with their family members. There are people who had to be released to bring back their employees. Does it mean we need to prepare better for crisis, for disasters? What about learning institutions? Does it mean we are also very weak in research? What about the research fund? Is it something we have to cry for? Right now, if you go to where Dr. Wallen is, they have data like this. Right now, we can only do a lot of guesswork, or we do a small survey, like 2,000 employees in Kenya. That is not the number we have. And then we are bringing out that data of 102,089, and we are talking about the corporate challenges of COVID-19. Is it an awakening moment for everybody in the learning institution, in the leadership, and the family level? What about the the faith-based institutions are the ones that lead this nation. Does that mean people have been so dependent on you, they cannot stand on their own in their terms of their spiritual well-being? What is it that you need to do differently right now to ensure that these people without you, they can still stand the test of time? What about we Africans and the way we believe in social networking and all that? Does it mean now we start looking for ways we can maintain that social connectivity just in case we get another COVID-19 with another name? So the way forward is everybody to be involved, everybody to be involved. Thank you so much, Dr.
Thank you. Thank you so much, Dr. Gitao. Kindly remember, you can send your questions to us even as we continue to interact. We'll be having a Q&A session, and would encourage all our participants to send their questions or their comments. Dr. Wallen, let's pick it from there. Again, we are talking about navigating home and work responsibilities, and we are asking ourselves, how do we navigate that space? When you think about the stress that is coming with it, as we have rightly said, how do we navigate that space? Maybe you can share with us a few things here and there that we need to do in order to navigate that space in a better manner.
Yeah, of course. Thank you. So I think things like communication would be the first on my list. Speaking about expectations with one another. So to my earlier point, you know, I don't necessarily know what stereotypes or what expectations other people hold. Maybe it differs from my own, even within a family unit, within a husband and wife. So to actually have the opportunity to say, like, what is it that you expect the distribution of responsibilities to be? What is it that you expect will be your time and my time, and time to get rid of some of this stress that we're experiencing? And, you know, are we communicating about that stress, or are we keeping it inside and letting it destroy us in some of the ways that Dr. Gitao has been discussing? I think, you know, realizing that what a person says they want might not be the same, or isn't often the same, as the underlying thing that motivates the thing they're asking for. So to sort of borrow from the language of negotiation and conflict researchers, the thing I say I want is just one manifestation and one reflection of the really important thing, which is the why, which is the underlying thing that causes me to ask for that. And maybe, you know, there's no way for you to give me the what I'm asking for, but there are lots of ways for you to get me that why, the thing that is motivating me to ask for that. Maybe you have some way to help me that I haven't even thought of, because I don't know what you can offer to me. And so to open up that conversation and just to speak about, you know, here's what I'm feeling right now. Here's sort of my expectation. I think you ought to be doing the outside work and the cooking, and I'll do the house cleaning and this, and then these are the hours where you're with the kids, and this is when you're teaching them, instead of just like letting it happen haphazardly and accidentally, and then making people upset with each other because they have a very different expectation that their partner or that some other person simply doesn't meet. And I think we need to resist this idea that the other person isn't doing what we expect because they are trying to be difficult or being a pain to us. They might just not know. And I think it's a very simple step, but it's a very overlooked step. And it's a sort of difficult step to trust the other person and be open about, you know, this is what I need right now. I'm undergoing this stress from what's going on. Hey, you know, I expect you're going to be with the kids this often, and why aren't you doing that? You know, maybe there's a very good reason. Maybe in terms of timing, there are just differences. Like some people might have a busy period at work this week, and so the partner needs to do more of the housework and the kids, minding the kids this week, and then next week that's all going to change. And I think people get stuck in this sort of like moment, and we've all joked that nobody knows what day it is anymore because we've all been stuck at home for so long, and it's like this endless loop and repetition of the same thing. But I think we need to kind of focus on there's time involved too. There's another dimension here, and we could change some of how we share responsibilities today from tomorrow and from next week, so that it's not always going to be this on you like it is right now, and setting up a plan for that. revisiting that plan. You know, I don't expect people to get it right the first time. I expect there's going to be, especially early on, we're all getting used to this. It's a very difficult time for everyone. Nobody has, I think anyone alive today, for the most part, has experienced something close to this. If any, 100-year-olds made it through the flu of 1918, maybe that's the closest analog. So, those are some early steps. I think it's a tool that we all have access to. It doesn't require spending money. It doesn't require, getting an expert involved. It involves time, and it involves you talking with somebody. And I know that's easier said than done, but that would be one of my first suggestions.
Very good. That in terms of, as we think about our mental wellness during this time, what is coming out clearly is that at the family front, as we think about balancing all these things we are talking about, that communication is very important. Our expectations need to be spelled out there. Responsibilities and roles also need to be clearly defined. Some questions are coming here and there, and maybe to Dr. Gitau. One of the things that came out is that there is a lot of conflict at the home front that is leading to gender-based violence. Maybe you can share some insight on how to go about conflict, especially at the home front, as we think about navigating this space.
Yeah, and you'll be so shocked. Thank you so much, Dr. Kagonda. It might not even be very, very different from what Dr. Wallen has said. Communication is very important. And just like he has said, is that people talking, people have solving their problems. But in most cases, most couples, especially where I come from now, this is Kenya, this is Africa, they have what is called the written, the unwritten, the unspoken, the spoken indirectly. We don't talk directly here. Somebody can just come home and say, I am now the donkey of this home. This is the way Africans we talk. We talk in proverbs, and we are not direct. But this time with COVID-19, you had better be direct. Direct with respect that I am burning out from A, B, C, D. Hey, can you help? Because here in Africa, I don't see things changing very fast. And especially with men thinking that being in that house before 6 p.m., even now 9 p.m., is just one of the sources of conflict. But I want to say it is actually a manifestation of poor communication skills, ineffective conflict resolution skills, or deficient conflict resolution skills. And I also want to say the marital relationships need to be revisited. People need to go back to the drawing board, because some people are saying, I knew I was living okay with my wife when I could go very early in the morning to work at 5 a.m. and then come back home after midnight, find all of them asleep. So people are basically living like that. They were robots under the same roof. So long as we can take care of the children, we really don't have to talk. But right now with the curfews, restrictions on movement, you have to be confined within a city. And so we are having men doing things that they were not doing before, coming home with their beers, with their drinks, and coming home drunk. Their children, some of them have never seen their fathers drunk. Even women, because I don't want to just say, although more men than women drink here in my country and really go out drunk and behave in a drunken way than women do, but we are also seeing this trend. We have seen women running away from their homes, and to actually make sure they are punishing their men, they leave them with children. There was this video that also went viral of a boda boda rider. Boda boda rider is a motorcycle. Here is one of the most common means of transport. And he had strapped his child at the front and carrying a passenger at the back. And you could see him during small breaks feeding that child. But that tells you that there is a real issue in that marriage, in that family setup. So if people can agree, and this one is acceptance, don't live in denial. When I leave my child, that doesn't mean I am actually a good nurturer or a good parent. It means I need help. So if people don't live in denial and accept, first and foremost, the marriage, the family has been thrown into a crisis, and we need to sit down and talk about how this is even affecting us. And then we ask for our own solutions from ourselves, because nobody's gonna come and run your life as an individual. No one is gonna come and run your marriage. No one will come and run your family. It has to be you. And when probably we take it out, because here we are also used to respecting authority so much. If you see a police here in my country, is when somebody is wearing a mask. But when there's no police around, I don't need the mask. So COVID-19 is not the thing that scares people. It is the authority. And so if it has to be the way probably right now to use the local, we call them the assistant chiefs, or that should be the person at the grassroots in terms of government leadership, to help build those, we call that initiative or project Nyumba Kumi, where you have the cells of 10 houses. And within these 10 houses, you have a leader. And the regular monitored meetings where cases of gender-based violence can be reported on regular basis, cases of teenage pregnancy, rape, and what have you can be communicated, where people can come up. And this is something I have tested, Dr. Kagonda and the other panelists present. I have tested it in the slum, where I have gone and told parents, these are your children. You may not have the smartphones, but I can provide one laptop. At least I can spare one laptop where you can download. I can spare a little money where you can buy bundles and download some of those revision materials that other children elsewhere are. But I've just taken candidates and shown parents you can do it. You can live with the minimal resources. Those people who are used to a lot of money right now, can we accept the change? Change management can also happen at family level. And this cannot happen to people who are in denial. It can only happen to people who have accepted. It can only happen to a leadership that has accepted we need to re-engineer the way we are running business, right from home all the way to the top of the government leadership. If it's about learning institution, this is the time. Because right now you will see schools like Harvard, and I haven't seen this in Kenya. You can see there are so many of Kenyans who have enrolled at Harvard School, right? Whichever school it may be, that they are taking professional courses at this time. At least you will show a paper, you will show something you did during the COVID-19 crisis situation. For us, what do we have for our students? I'm actually trying to do that, and I'm very encouraged by the number of counselors, and I have seen many of them. I have seen Palesa in this platform all the way from New York, who has participated in some of those platforms that I'm taking people through crisis counseling courses, such that when this situation increases in terms of mental health need, we have not only counselors, but crisis intervention counselors. So it's the big questions, Kagonda, for us, a big challenge, but I always say, if you are not in acceptance mode, you might never change. You might never change, and you might never help anyone.
Mm-hmm. So we need to accept that the changes are here, and the big question is, how are we going to cope? And those are some of the questions we are addressing, because if we don't address the question of coping, then it may affect us in many different ways. A comment that has come, and Dr. Wallen, I can ask you to comment on it. Somebody have said that the problem we have in homes is gender stereotypes roles. Can you comment on that? I think I know you had discussed it, but that has come up again.
Yeah, and again, you know, the gender stereotypes, I don't want to make it as if the people who hold them are evil or bad or poorly motivated or thoughtless. This is all of us have stereotypes about every demographic group, a professional group, like everything we encounter, our brains as humans are just wired for pattern recognition. And it's, in a lot of ways, the formation of the stereotypes is not our doing. It just happens because of, we live in a society and we watch things and we make conclusions about patterns. So it is a problem in the effects that it leads to. It's not a problem that they exist, although I would like in the long term to see them change and become more egalitarian, of course. So I just don't want people thoughtlessly relying on these stereotypes. I think that's where you run into trouble. And I also don't want women to subscribe to stereotypes about women and men to subscribe to stereotypes about men, such that their universe of options in terms of activities, characteristics, professional pursuits is limited in some way. And so it's not just men who are stereotyping women, it's women put pressure on women to act in accord with the stereotypes, and men on men, etc. So in terms of the domestic situation, I would just suggest be aware of them. That's the first thing. Just be aware that the stereotypes, like, are you only doing this because there's some default, some expectation, and you haven't really thought about it? Or is there some agreement or some more thoughtful process that led to this distribution? And if you see that it seems like the woman is doing things that are stereotypically female and the man is doing things stereotypically male, think through that. Is that the best solution to the problem? Is there a better use of your talents right now? And not to react negatively when somebody acts in a different way. You know, there are wide distributions of whatever characteristics. If you were to graph these on a normal curve, they're very wide distributions that overlap a lot. So you'll find plenty of women who are in reality physically stronger than plenty of men. It's not that rare for a thing to happen. And the same for interests, and the same for professional pursuits. And so, you know, just because you see somebody from that category, it shouldn't tell you as much as maybe humans have been wired to believe. I don't know if that addresses the question, you know, having not seen it, but that's my point with stereotypes. Just get them out in the open, discuss them, and don't just let that be the default.
Okay, thank you. Thank you for that. Another comment, and this goes to you, Dr. Gitao. Briefly, you can let us know if there is any statistical data on the impact of COVID-19 on teenage pregnancies experienced by female students in Kenya.
Well, thank you very much for that question. And I think if you go online, you will find that, I know there was a lot of debate as in how did you collect this data, because it reads like we have like 6,000 at the moment. We had like 4,000 in one county alone. But I know people had lots of questions. How was this data collected and all that? But the truth is, in Africa, when people raise a red flag, it is true. Because if you go, like I tried to go in one of the few counties, I called some of the county managers. When I talk about county managers, it could be those children in the gender children welfare departments in counties. Even if they did not have the raw data, they were basically saying it's true that there are cases of teenage pregnancy that have been reported. We have also seen the media, because one of the things that the media has done in Kenya is to highlight that plight. And they have shown us children in the moment, here and now, pregnant, 13-year-old, 12-year-old, and children even confessing, even if some of these pregnancies are just a product of their opposite sex relationship, we have had like 60% of them is about grown-up men. Most of those men, some of the reasons are just so weird. Some of them are still cleansing themselves from the HIV virus. Others are saying that my wife ran away and I have to really take care of my sexual needs. And if I find a girl out there who is really not taking care of herself, can you imagine? Which is sexual exploitation for some, because some have gone to say, I don't have food, and somebody has been wooed to go for food. And at the end of the day, you come out of that place pregnant. we are also having a situation whereby it's like basically everybody is stressed and burnt out. So nobody is caring. And you will not find these situations happening where we have the elite. You will find this is happening in remote areas of this country. You will find this is happening in informal settlements more. And at the end of the day, the big question is who is taking care of that low community member, that lowly national member? Who is? Because it makes me feel very sad when I get to know that girl child in the slum who doesn't even live in a permanent house is the one who is being raped and impregnated. And that is the same girl that when this case is reported probably to the local administration, that wazes are community elders come together and say, we can sort this out in-house. And there goes a life that has been destroyed forever. So we have very beautiful legal instruments, but even the president accepted yesterday, which impressed me, because that is no longer living in denial. That can we do it differently? And he actually ordered, that's why he ordered for serious survey or research on cases of sexual and gender-based violence. Because probably those surveys, few surveys that are done by a few people, maybe some are meant to highlight what is going on, but we need the exact data, which I may not be able to say I have at the moment. But the truth is, from what we have seen on the media, from what I gathered, because I like calling and finding out, is it true these cases are there? Like in one of the counties that was leading, I had one of the key counselors in that county telling me, Susan, here we have normalized sex. So we talk about sex, and right now, because the children are at home, we talk about sex in a manner that they think it is actually a good thing to do and engage in. But without telling these teenagers, these young adults, that sex also has its own consequences. Reproductive health rights also is a big issue, and one of it being right information and access to that right information. It appears majority of them, even when they have been, they actually been interviewed, they are saying, you know, he only told me to get in there, I will only finish with washing the clothes or cleaning the dishes, and then I'll get my 20 bob. That could be like $2, and the work is done. But out of that work, he also takes my body. So at the end of the day, we are asking, what about the reporting systems? Because you are supposed to not to destroy any evidence. In some countries, you believe the child first before you believe the adult. Here in Kenya, you believe the adult first. I think it's a high time we change the way legal instruments are implemented, especially in cases of sexual and gender-based violence. You have totally destroyed the life of an innocent, naive child in the name of she knows better. And at the end of the day, tomorrow we are crying that, oh, we are having so many street children. Where did they come from? These are issues of SGBV in this country that needs to be taken very seriously.
Thank you.
So for me, I would say proper research, reliable studies to be carried out. Yes.
Thank you, Susan. Thank you, Susan. So as we think about navigating work and home responsibilities, what we seem to be saying is that there is a lot of responsibility that is expected about children and parents, and how to navigate that space, and how to navigate that space so that children are also safe, and also parents' mental well-being is taken care of. We are coming to the end of our webinar today, and I will just read one comment before I ask our panelists to say their final comment. But somebody has put it this way, maybe as a way to summarize our evening or morning. Individual mental health and well-being equals to family health. Individual mental health and well-being equals to family health, equal to society, future society, family health, and individual health. It's a cycle, and if there is a challenge or situation, it requires to be accepted and attended individually. So it summarizes what we are saying, that in this space where we are navigating home and workspace, individual mental well-being is very important, how to take care of our mental wellness. And with that, Dr. Wallen, I don't know what will be your last words, even as we are winding up this session.
So very quickly, this has been a very difficult, challenging time for most people in the world, and to varying degrees. People who've lost loved ones, people who've experienced some of the horrible violence that Dr. Gitao is referring to. And I think we all need to acknowledge that, and it's affecting us all in different ways. But I do want us, I mean, this is a moment of shock, and shock can lead to change. And you know, I think we're seeing this. Dr. Gitao referenced this in some ways, but you know, I don't know that they're necessarily tied together. Maybe they are, maybe they're not. But the things like the Black Lives Matter movement in the U.S., you know, I think there's motivation for us to be paying more attention to the other and what's going on around us now that we are all connected in society. And you know, to be shocked out of normal. This is always the way we've done it. This is how things are, and to try where possible to move into something better. And you know, I don't think anyone would ever call this crisis positive in any way. But as negative as it is, as horrible as it is, maybe we can make something better out of it, something more positive, whether that be at the level of re-examining gender roles, at the level of how a society views the workplace, where it's okay to work, how to distribute responsibilities, how to protect its citizens, and especially those who are disadvantaged in a society, the poor, the people who don't have a lot of the privilege and advantage that other people in society have. I think attending to the needs of those people now, I hope that this is at least a wake-up call in that way, and that, you know, in the near future and hopefully in the long term, something good can come out of it if we are smart about this and are thoughtful about it. And I guess that would be my wish, that we look back in 10 years and there's been all these changes in all of our societies where, you know, we didn't want to have had to go through this, but something good came out of it. It caused us to reflect, and we're better off in certain ways.
Thank you. Thank you so much, Dr. Wanga. Dr. Gitao?
Thank you so much. It is true that COVID-19 has put the whole world in a situation that we never knew before. But it would be important to say that COVID-19 has not been all bad or all negative. However, it appears that all the changes or challenges that COVID-19 has brought globally has like narrowed down to our mental health status. And so for those of us who've been able to navigate through these challenges, we are celebrating. Some people have become billionaires in this country. Some people are making more money right now than they have done before, whereas some people have totally become paupers. So self-awareness to me is very key. If I begin with an individual, that I ask myself, how has this COVID-19 impacted my physical life, my medical health, my spiritual health, my social health, and going down to family health, and asking yourself again, my work-life balance. How is it? What would I say? Because even for me, every day, I would not lie to the panelists here. If there is a time I have experienced a lot of pressure on my work, it is this time. But because I have the self-awareness, I know when to say no. I just know it, and I'm telling you, I would never take any cause at that time when I say it's not for my mental, social, physical, and spiritual well-being, and taking time out. Even in the workplace, it's just the other day we were saying we need to have a sober way of working. Otherwise, we might end up doing nothing. So self-awareness is very important. For the partners, the couples under the same roof, again, self-awareness. And I'm echoing the words of Dr. Wallen here, saying it is true. Can we speak out? Can we raise our voices higher in a respectful manner? Can I tell my partner, hey, this has really pressed me down. Hey, this is what I was expecting, but this is what I'm getting. Can we have open communication, candid communication that comes down to our children? Can we have some webinars in our houses, sitting down and saying, how do this COVID-19 has changed this family? You will hear those children talk. This moment, the parents that took this change positively have discovered their children in a way they have never discovered before. I want to talk because I'm also a parent. I never knew the children I'm having under my roof are the children that I have discovered with this COVID-19. But I am willing even for them to educate me. That doesn't mean you are a fool. Even for us accepting to come and participate in such a webinar, it's because we know, yes, this is an issue that needs discussion. We need to look at how we navigate our work and home life or family life, balance, roles and responsibilities, to relook into things differently. So I want to say, let us be open-minded. And when we talk about relationships, I like telling people, Kagonda, I will not leave them without telling them mindfulness is very powerful. You only need to listen to yourself in the here and now and just feel you. Feel the presence of your body to begin with. Feel the presence of your mind to begin with. And you will definitely have the solutions to what you're going through. But we rarely take a moment to reflect and be mindful of the current moment. And if everybody did that, it doesn't matter whether you are in America, you are in South Korea, because I saw Florence Busega here from South Korea. I have seen many of the counseling psychologists present, and I'm sure they had so many questions from Dr. Wallen, especially about institutions and how they can even learn online. They are here, by the way, and I want to encourage you counselors, because you had told me you want to ask those questions. I have seen Nan Teacher there. I have seen Harendra Patel there. I have seen Nan Gitau there. If you look at those counselors, right now, some of them are already pursuing programs that they are not pursuing anymore. And so right now they are saying, and for me, I'm one person who says, access knowledge from wherever and whichever means that is available for you. So can we even take this discussion to another level? Because we need to meet our needs as united front. No white, no black, everybody COVID-19 has it. No poor, no rich, everybody COVID-19 has it. God bless you as we continue this conversation of work-home life balance.
Thank you, Susan. Thank you. Clearly, we can see our panelists are very passionate about the topic we are discussing today. And I hope this is and I trust this is the beginning of many conversations to do with the topic we are discussing today, because it's a real issue, it's a big issue, it's having major effect on us. Work-life balance should continue even as we navigate through working at home and all the challenges that come with it. We come to the end of our session or our webinar, and I want to take this time to thank you so much, our panelists, Dr. Wallen and Dr. Gitau. Thank you for the insight and all the issues that you have brought out. And I'm sure as we come to the end, the participants have picked a few issues here and there that will help them as they navigate that space. Credits to Columbia University, again, for creating this forum where we can come to discuss, and special credits and thanks to Columbia Global Center, headed by Dr. Murugi, for again organizing these very insightful, life-changing webinars, because we are talking about real issues that are affecting people there. And as we come and discuss, again, we believe that lives are being changed, one life at a time. Thank you so much, all the participants. Thank you for all your questions. Thank you for all your comments. We really appreciate, and we'll see you next time when we have another webinar. Thank you.